How are you doing, sir? Now we're gonna go ahead and start the physical assessment of your head, eyes, ears, nose, throat, mouth, and neck. Okay. The first thing we're gonna do is inspecting the head. So we're gonna be inspecting the head for any. I'm gonna start palpating also. Okay. Mm-hmm. I'm gonna start inspecting for any erythema, any redness, any rashes. We go ahead and look in the back and front for the symmetry. So if your head is symmetric, no trauma visible. We start palpating for at the scalp to see for any redness, any rashes. Your hair is even distributed. There's no balding spots. There's no lesions seen in all of your head and your scalp. And we go ahead and we continue inspecting. Now I'm gonna be assessing the eyes. And the eyes, they're both symmetric. There's no redness. There's no trauma visible. I'm gonna open your eyes, okay? I'm gonna start touching you. Okay, the sclera is white. The conjunctiva is pink in both eyes. There's no trauma, no ptosis, no exophthalmos. Both eyes are intact. Both eyelids are symmetric. There's no dropping or anything. Now can you please look at my nose? Now I'm gonna test for pupillary response to light. So, okay. Now look at my pen. And then look far away. Look at my pen again. Okay, pupils are equal, round, and reactive to light and to an accommodation, directly to light, and reactive to directly concentrally, meaning that when I shine light in one eye, it constricts the pupil that I'm putting the light on, and also concentrally to the other one. That's bilateral. Now we're gonna start assessing the light reflex. Can you please look at my nose? And when we shine the light to the pupils, we can see the light reflex a little bit nasally in both eyes. Now we're gonna start assessing for extraocular movements. Okay, we're gonna assess for motor movement of your eyes. Can you please look in the mirror and look my pen right here, the middle, and then you're gonna follow. You're not gonna move your head, but you're gonna follow the pen. Okay. Okay. So start. Follow laterally. You're gonna follow high. You're gonna follow low. Back to midline. The center. Then we're gonna go lateral, high, inferior. And then we're going to start to this center. Now we're going to test for convergence. Follow the pen, okay? Okay, the eyes converge, and there's no nystagmus or no lateralization of the eye, the extraocular movements. Now we're going to assess for the visual fields, peripheral visual leads by confrontation. So what I'm going to do is I'm going to be putting my hands outside of your field of view, and you're gonna tell me whenever you see my fingers wiggle. Okay, it's called the finger wiggle test. Okay, so I'm gonna get close to you. You tell me when you see my fingers wiggle. Okay, on your side. Then look straight up. Look at my nose. Thank you. Okay, you're gonna see. Okay. Now, okay. Now start over here. Okay, and now we're starting the other side. Okay. Peripheral visual. Peripheral visual is intact. Now we're gonna start with the ophthalmoscope examination. Okay. First, we're gonna start at 15-degree angle. Can you please look straight up? Focus your vision in one object and don't deviate from that object. Okay. Okay. Start 0. Okay. Ophthalmoscope at a 15-degree angle. We're gonna shine light. We're gonna look for the red reflex, and we're gonna go ahead and get close. I'm gonna get close to you. Okay. Follow the red reflex into the face. Okay. You're gonna be looking. Okay, the disc is visible. We're gonna follow the arteries and the veins. Okay, the optic disc is visible. There's no foreign bodies. The fovea and the macula are visible. There's no hemorrhages or anything in the eyes. Now we're gonna do in the other eye. We're gonna go ahead 15-degree angle, the same thing with your left eye, left hand to the left eye. For the patient, we wanna get close to you, okay? Follow the line. Same thing. Optic disc is visible. Fovea and macula are visible. There's no foreign body, no hemorrhages. Oh, okay, sorry. Okay, the red river was present, the cornea was visible. Now we're gonna go ahead and start inspecting your nose. We're gonna use in this case, we're gonna use the otoscope to inspect your nose, okay? Okay. Can you please tilt your head back a little bit? Okay, we're gonna first palpate, inspect the nose for symmetry for the septum. Septum is midline, is intact. Tell me if you feel pain, okay? There's no pain to palpation to the nose. There's no redness, there's no masses visible, there's no crepitus, nothing like that. So tilt your head back a little bit. So you know, look at the nose inside. There's no drainage. The mucous membrane is light pink. Turbinates are visible. There's no polyps, there's no blood. I'm gonna check for patency. Can you please breathe in? Okay. They're both patent. There's no abnormality seen. So that's done for the nose. Now we're gonna look at your ears, okay? For your ears, first of all, we're gonna inspect both ears for symmetry, alignment. There's no redness, there's no masses, you can not touch, okay? So palpating tragus, no tenderness. You pull the tug test, you do the tug test in both ears. Do you have any pain?
No.
You have no pain, so that will be indication for any ear infections. You can also palpate in the back with the mastoid process for any. Do you have any pain?
No.
No, there's no pain. I looked into your ear canal. You gotta when you're talking to the patient, you can start looking for little things like when the patient asks you to repeat the questions. Maybe there's some hearing impairment. Okay, we're gonna do two tests. The first test that I'm gonna be doing is the Weber test, which is to identify lateralization of sound. Okay, so you're gonna use the tuning fork. I'm gonna this and put it on the center of your head. Tell me where you hear or feel the sound, okay?
Both.
In both?
Yeah.
So that means that there's no lateralization, both ears are equal. Then you're gonna do the Rhine test, okay? The Rhine test is to detect for air conduction and bone conduction. So we're gonna do the tuning forks. That test is done in individually in each ear, okay? So I'm gonna do the tuning forks. I'm gonna touch it right here, and you're gonna be hearing it, and then I'm gonna put it in front of your ear, and you're gonna tell me when you stop hearing it, okay? Okay, so I'm gonna put it in your back of your ear right there, the master process. Tell me when you stop hearing it.
Okay.
Now put it in front of your ear. Tell me when you stop hearing it.
Okay.
Okay. And in normal hearing, air conduction should be longer than bone conduction. Okay. And then you go ahead and do it on the same side on this side. Tell me when you stop hearing it.
Okay.
Then I'll put it in front of the ear. Tell me when you stop hearing it.
Okay.
And air conduction should be longer than bone conduction. Okay. Something that I forgot about the eye exam that I already moved on. I know, but I forgot that visual acuity. Usually, visual acuity is done before with a Selen test. But we have this little card that could also be used. So we're gonna hold it at 14 inches away from the face of the patient, and we're gonna ask to cover one eye. Thank you, and then you're gonna tell me which line are you able to see. Can you please tell me which this line is?
Yeah, it's 7438.
Okay, and can you tell me the next one or no? No?
95623.
Okay, and then the next one, that's it?
Yes.
Okay, so your visual acuity in the left eye is 20/20, and now we're gonna rest a little bit, blink a little bit, you can look away, and then now cover the other eye. You're gonna tell me, start on that one, and tell me, you can read it, what it is.
95623.
Okay, and the next one?
That's
it?
Yeah.
It's the same one as the other one. Okay, you also are 20/20, and now both eyes. Yeah?
95623.
Okay, it's 20/20, so your visual is 20/20. We documented as both eyes, right and left. Our visual acuity over 20/20. That was for the eyes, sorry. Coming back to the ears, now we're gonna inspect the ears and the ear canal for any discharge. So we're gonna use the otoscope, okay? So we already inspected the ears, we already looked at, we palpated tragus, the article, there's no pain, no tenderness, no redness, and no visible discharge or swelling. We're gonna look at the ear canal, okay? First, we're gonna start with the right ear. We're gonna go ahead and check the external canal of the right ear. The external canal is pink, there's no drainage, there's no blood, there is no swelling. You look at the tympanic membrane, and tympanic membrane, you pull the ear up and back for adults. The tympanic membrane was pearly gray. The malleus was visible. The short process of the malleus, hand of the malleus was visible. Cone of light to the right ear was at 5 o'clock, and the umbo was also visible. Now we're gonna go ahead and check the left ear, and then I'm gonna give you my back, and the same thing. So if you can see right there, and the same thing, you look at the ear canal, the external, you pull the ear up and back, and then you look at the external ear canal. There's pink, there's no drainage, there's no blood, there is no swelling in the ear canal. Then you look back into the tympanic membrane. The tympanic membrane, okay, we're done here. The tympanic membrane was pearly gray on the left ear also. The malleus was also visible with short process, and the handle, the umbo was also visible, the landmarks. Cone of light to the left ear was at 7 o'clock. So that is for the ear. What else? What else? Okay, now, sorry. We're gonna do the whisper test, okay? So the whisper test, you go ahead, I'm gonna include one of yours, the left ear first, and I'm gonna whisper some words, apple, or that you can say, so see if the patient can repeat it, okay? So tell me if you can hear this. What is this? What is that? Okay. Then you can say a couple words, same thing, and then do the other, and then whisper.
Yeah.
Okay, and then that's the negative whisper test with normal. Now we're gonna inspect we're gonna get the otoscope again, and we're gonna inspect your mucous membrane in your mouth. Okay. Okay, so you can inspect the lips first. Look at the lips. There's no redness. They're pink. There's no discharge. No cracking. Open your mouth, please. You can check any mucous membrane. Sorry, the light is not working. You can do it with your pen light. Sorry. Okay, open your mouth. Then you can see the mucous membranes. And now stick your tongue out. Say So tongue is midline. The uvula is midline. Stick your tongue up. You can do the salivary ducts intact. There's no masses on the floor of the mouth. Stick your tongue out. You can inspect the soft palate, the hard palate, the oropharynx, the pharynx, the oropharynx. You're gonna check for any masses, any lesions. There's nothing in your mouth. The dentition is all intact. There's no cavities. There's no broken teeth. Now you're gonna start checking you can check the neck. The neck is midline. The trachea is midline. Supple neck. And please do flexion, extension of your neck. You can do lateral. You can do a whole circle to assess for range of motion. So all the neck is range of motion. You check for the You can also, this is going to be part of the neurologic exam, but you can also at this point do the neurologic exam, the feeling and everything else that we're going to be talking in the next video. But you can also, as a patient, to puff up your cheeks. Okay, so that's all normal. Now we're gonna, what else? We're gonna palpate for the lymph nodes. Okay, we're gonna palpate the lymph nodes. We're gonna palpate we're gonna touch, okay, preauricular lymph nodes. We're gonna palpate the submandibular, tonsillar. Then we're gonna palpate the anterior cervical, posterior cervical, supra clavicular, and you can do the infraclavicular. There's also one that I'm submental, that they're right here. That's the one that I was missing. So you can palpate that, feel for any swelling, any tenderness, especially in a recent infection or anything like that. I already checked for the tracheal placement was midline. Now you're gonna check for the thyroid, okay? The thyroid, the isthmus of the thyroid, check for landmarks. And the approach to do the thyroid, you can do some light to see where it is. But if you can't see it, we're gonna do a posterior approach. We're gonna go behind the patient, and I don't have a cup of water, so we're gonna imagine that I give you a cup of water right here, and you're gonna assess the thyroid with the patient drinking water or swallowing, and so you can palpate the thyroid. So you palpate the thyroid from the back, and you could ask the patient to swallow. You're gonna feel the thyroid move up and down. The thyroid is palpable, but there is no enlargement in the thyroid. You cannot feel no masses or no asymmetries in the thyroid. And I think that is it for the head exam. Thank you very much.